Dr. McCants-Katz, I have a kind of a follow-up. And it's a follow-up not only to what I asked earlier, but actually to a previous hearing where you were talking about opioids. In my previous line of questioning, I was asking about how do we monitor outcomes. Last committee hearing, I asked how do we monitor a specific program? If we have treatment program A and treatment program B, and treatment program A has a high recidivism rate, with a lot of folks being perhaps overdosing in an emergency room 2 weeks after discharge, and we have program B where they have a more effective approach, and we don't see that sort of thing on billing data or however. And I'd asked you last time if SAMHSA was instituting those kind of review processes, and I think the answer I got, great idea, but probably not at this point. In relation to what I asked earlier, is it possible for SAMHSA to do that without a cooperative agreement with CMS to look at billing data, to see if there's some marker of recidivism, for example, billing for an emergency room visit a week after discharge? You follow what I'm saying? What I'm really trying to get is how do we effectively look at programs that are treating folks for addiction to know whether or not those programs are effective. And the taxpayer gets the best deal for her dollar, but more importantly, or as importantly, the patient gets the best outcome relative to recovering from their addiction. Thoughts?
So the issue around CMS and their billing data is one that we have to work on. But we are, so yes, I am reviewing all of SAMHSA's data collection programs right now, and we are going to be making that data more available publicly. So it's not just a matter of do program, and these would be our programs that we're funding, but it's not just a matter of collecting that data so that we can see whether the programs are good, but making it available to the public. And so we are working with our Center for Behavioral Health Statistics and Quality to look at means by which we can make that data more available. The other thing that we do is, I will tell you that for the STR program, I'm a clinician.
SDR is?
STR is, I'm sorry, it's the state targeted, it's the $500 million a year for each of 2 years. So I'm a clinician, and I love clinical work. I am meeting with my staff about every single grantee. We're looking at every single program to see how the states are using their money. They're all doing it differently.
So let me ask,
yep.
In follow-up, if states are doing it differently, is there a common way that you can say, this is how we wish you to evaluate? Because really, absent billing data, that apparently is only available from CMS, it seems like it would be very difficult to evaluate recidivism rates. Is somebody moving to another locality? Many of these treatment programs are at a geographic distance from the place where the patient begins, right? So if there is a way to evaluate without billing data, one, does it exist? And two, is CMS promulgating this as, listen, we want you to evaluate, and this is how we wish you to do so?
Yes, and so the answer to your question is we have several evaluations of this program ongoing, and we are monitoring the states to make sure that they're using evidence-based practices. We have one evaluation that's being done by CDC. We have another that's being done by a contractor, and with that data will be made available publicly. So that is an ongoing project for SAMHSA.
And by the way, I don't personally think the data should be used punitively. It could be also total quality management.
And the other thing that we do is that because we're working so closely with the states and because we have a new program of technical assistance, we will also be asking the states to bring forward data on their programs because they have abilities to see whether their programs are working.
And when will this data be available for the general public or for Congress to review, the first set of it?
So I don't know the exact answer to that, but I will find out and get to you about that.
Fantastic.
Absolutely.
Senator Murphy?